ethics. It lies at the very heart of the profession of nursing. In fact, the American public rated nursing as the field with the highest standards of honesty and ethics in a Gallup survey on various professions. However, longer lifespans, increased dependency on technology, and beginning-of-life issues are posing new ethical dilemmas. Diversity, staff shortages, and new demands for collaboration also challenge caregivers and managers alike.
Students are dealing with a lot of ethical, moral issues after they graduate. Do I give this medication? Do I not? Do I approach the doctor? Do I not? Do I tell this patient? Do I not? Knowing this, what will I do?
The Joint Commission on Accreditation of Healthcare Organizations mandates that institutions address ethical issues related to patient care and requires that health professionals be educated about ethics. This involves being aware of the ethical implications inherent in their work and being able to develop a philosophically consistent values-based framework upon which to base decision-making. It starts with understanding some fundamental principles. Ethics stems from morality. Morals involve a basic sense of right and wrong, good and bad, notions that affect the human conscience. Things like respect, freedom, and love are considered moral concepts.
How are you feeling?
A lot better today. My leg hasn't been bothering as much lately.
In fact, a nurse's own motivation to care for others is usually generated by a moral perspective. Morals inspire rules of action. These are called ethics.
Our policy supports the ethical standards of protecting our patients' dignity in any way we can. That's why we provide privacy during the personal care of Mr. Jones, even though he's in a coma and not aware of his environment.
I see.
It demonstrates respect for him as a person.
Ethics applies to the application of morals, which become the accepted rules and norms and an integral part of nursing. A term that is sometimes used interchangeably with healthcare ethics is bioethics. Bioethics specifically focuses on the moral aspects of healthcare and originally grew out of a concern with life and death issues.
We've called this meeting of the Bioethics Committee in response to a nursing request for an ethics consultation on Mr. Ernest Jones. Mr. Jones has no advance directives in place, and the two sons are in strong disagreement about life support.
Issues like advance directives, organ and tissue recovery and donation, and informed consent are common topics of discussion.
And an ethics committee is very valuable in terms of everybody sitting down and trying to arrive at a solution with a multitude of different perspectives.
There are many principles used when discussing bioethics. Beneficence is one of them. It refers to taking action to promote the welfare of others.
Set aside about 15 minutes so that we can go over this.
Mercy, kindness, and charity are all qualities of beneficence. The term non-malfeasance is related to beneficence. It essentially means do no harm. This is an overriding principle for all patient care.
You want to do whatever is in the patient's best benefit and do no harm. Part of that also includes intent to do no harm.
We can also do emotional harm, and we can do emotional harm through not necessarily malice aforethought, but by providing culturally insensitive care, not being aware of perhaps what the patient thinks or how the patient feels.
Respect for persons is fundamental. There are many ways to demonstrate this. One way is through honoring a person's autonomy. Autonomy literally means self-governing, having freedom to make choices about one's life.
Mr. Benson, so you wanted to talk to me?
Yes, I've been thinking about my surgery, and I really think I need a second opinion. My wife agrees with me, and I want to postpone the surgery until we get it.
Okay. Sure, well, you have every right to a second opinion. I'll go ahead and let your doctor know. Do you have any idea who you would want to see?
In nursing, there are many implications with autonomy, such as informed consent, advance directives, and end-of-life issues. Respecting a patient's privacy is an important ethical principle. One means of achieving this is through the practice of confidentiality.
Yes, I realize you want the data, but I can't give out information about other patients without their consent. I'm sorry, ma'am, it's just confidential.
Confidentiality is emphasized in all